Hi, okay, today we are studying Chapter 3, the reproductive system, and I pray that it's not quite as awkward as all those 5th grade movies where they had to split up the class, boys here, girls there, and then dodgeball and recess was completely awkward and never the same after those movies. We are going to talk about the birds and the bees, and I have this little picture and they're saying, we do what? Okay, so it's no secret. We should all know how a baby takes place by now. Today we're going to talk about conception, and I'm going to jump in with the female reproductive sides. Miss Sharp will teach 1410, the male reproductive side in 1410. She begged me to let her teach it. I said, okay, yeah, fine, if you really want to. And so she'll cover that. So let's just jump right into the female reproductive system. Okay, so you have your internal reproductive organs, and obviously internal just means that they are inside. It's something that you're not going to see. The vagina is the first one, and it's the birth canal. Okay, so whenever you're studying this, you have to know your anatomy. You have to know your anatomy to put in a Foley catheter. You have to know your anatomy to just know what we're talking about. So if you're feeling a little sketchy or it just isn't quite making sense, get your A&P book back out and just go through the pictures and look. Right now we have a picture on page 51, and you can look at that and go along with me. So in your book, I want you to see where the bladder is, where the urethra is, but then of course where the vagina is. And the vagina goes straight up to the uterus and the cervix. Now when we're talking about a cervix and we're talking about childbirthing, that's what you hear, that's what they're talking about when you hear she was dilated to a 10 or she was dilated to an 8 and then she just didn't go any further, she didn't progress. It's the cervix that we're talking about. And for a baby to come out, the cervix has got to open up completely, and it's also got to phase, which means it thins out. It's thick and it will shrink down in a phase, and then it will dilate and go to a 10, okay? So that's what we're talking about. The uterus is a hollow pear-shaped muscular structure, and so when you're thinking about the uterus, think about this muscle, but also think of like a hot air balloon, okay? And when that hot air balloon gets heat and wind, it starts ballooning up and getting bigger. Well, that's the same way with a woman when she has a baby. The baby starts growing, that muscle starts stretching, okay? And so the function of the uterus is to prepare for pregnancy. So every month we are preparing for pregnancy, okay? And that is what happens when the uterus starts sloughing off, and that's called menstruation. That's the way the uterus prepares every month, okay? So another function for the uterus is to protect and to nourish that growing child. And then of course it aids in childbirth. That's responsible for expulsion of the child, the muscles, the contractions, that explosion out. Okay, uterus. In the uterus, there are 4 sections. The cervix is just what we talked about. That is what you're going to see, which dilates and it phases, okay? It connects the vagina and the uterus. And the very tip of it, or the very bottom of it, where here's the vagina and the tube, and here sitting on top is the uterus, which looks like a hot air balloon. That part right there that connects it is called the outer os. And that is what they're checking whenever they do vaginal checks or anything like that. They're seeing, is that dilating any at all? Is it phased? Is it soft? And we'll get into more about that, and we'll talk more about that. Okay, the uterine isthmus is what connects the cervix to the main body of the uterus, okay? Thinnest part of the uterus does not participate in the muscle contractions of labor, okay? It's not part of the contractions. This is also the part which would be most likely to rupture during childbirth. Okay. The corpus is the main body of the uterus, and then the fundus is going to be the topmost part of the uterus. Okay, so after a woman has the baby, she is in postpartum, okay? And in postpartum, we are going in and we are checking her fundus. And no, that's not some kind of fungus or a mushroom or something. It's called a fundus. And what that is where the uterus is starting to go back to its normal size. But it doesn't just happen on its own. We have to help it. And so we're going in and we are massaging that fundus. And at first it kind of feels a little bit hard, like a table, but you massage it, okay? It should be hard, it should be firm. If it's boggy, that's not good. That means that she is bleeding, and so we have to massage that. And you do it with 2 hands, and I'll show you in class where you can actually see a little bit better how we go about massaging a fundus. But you want to have 2 hands, one on her symphysis pubis and the other at the very topmost part of that fundus. And you're going to massage it, and yes, it will hurt her a little bit. She might scream out and say, "Hey, what are you doing?" And you explain to her, we have to get your uterus back to its normal size. We have to make sure that you're not bleeding. And then she'll say, "Okay, but be a little gentler, more gentle," or something like that. All right. So the walls of the corpus and the fundus have 3 different layers. And in these layers, those are the muscles. Those are what are responsible for the contractions, okay? So you have your parametrium, which is the outer layer. It's real tough. And then your myometrium is the muscle layer, and this is the one that is the most responsible for the contractions. Tremendous explosive power. And then the endometrium is the inner layer. Okay, so the paired fallopian tubes. Whenever we talk about fallopian tubes, I want you to automatically think that is where fertilization takes place. Okay, and there's 3 different sections: the isthmus, ampulla, and the infundibulum. Good luck saying that. Just say it as best as you can. Throw it out there. But a type of question that I will ask you isn't going to be, where does fertilization take place? Because I just gave you that answer. So that's too easy. But I want to know, which section do you think fertilization takes place? Okay, so figure that out. We'll talk about it in class. Okay, next one. Ovaries. Ovaries are the 2 sex glands, and they are related to the male testes, okay? They have that same, excuse me, they have that same relationship, okay? Female are the eggs, males are, of course, the sperm. Okay, they're located on either side of the uterus. And so you've seen pictures of the fallopian tubes, the ovaries, and here is another picture. Okay, so here's the ovary. And the ovary, although it looks like it's connected to the ampulla and the fallopian tube, they're really not. The ovary will release eggs, and then the finger-like projectiles of the fallopian tube are doing this, and they're actually sucking in the egg. Okay, and we have a really cool video that kind of shows that a little bit better. Okay, but the functions of the ovary, they produce the female hormones, estrogen and progesterone, and those 2 hormones are vital for pregnancy. Okay, those 2 hormones are what maintains the pregnancy. So those are very important, and you'll hear that a lot more. The ovaries also store the ova and help them to mature. Whenever a female is born, a brand new baby girl has over 2 million ovas. Now, they only use about 500 in their lifespan, but they have over 2 million just right there at birth, okay? And that's as much as they will ever have. The ovaries also are going to regulate the menstrual cycle in response to the anterior pituitary hormones. Okay? So regulation of reproductive function. Puberty. Okay, so puberty, you probably have all sorts of thoughts in your heads about puberty. It's when the voice box changes in the little boys, and they're all of a sudden talking like a squeaky boy, and then they drop down real low. Okay. So the time of life in which an individual becomes capable of sexual reproduction, that's what I want you to think of when you think of puberty. All of a sudden, little boy, little girl is able to produce another human, okay? And this occurs between 10 and 14 years of age, a really young age for such a responsibility. Okay, with puberty, what you're going to often see is the development of secondary sex characteristics first. So what that means is, like, for a little girl, you're going to start seeing her develop breast buds. And when she develops breast buds, it's going to be almost a rule of thumb, 2 years later she will start her period. Okay, and then menarche, of course, is the starting of her period. Another thing is, typically in girls, they will start having pubic hair right before they start their menarche. So that's another secondary sex characteristic you might see in a female. The menstruation cycle, it's reoccurring changes that take place in a woman's reproductive tract associated with menstruation and the events that surround that. So here is a great picture of the menstrual cycle, okay? And what I want you to know is that the typical cycle lasts about 28 days. So here on day 1, you see where it's menstrual flow, okay? So she has started her period, she's kind of at the end of it, and we're about to start a brand new cycle. Now, on days 14, as you'll see, that yellow line, which, not on your PowerPoints, but if you're looking on here, you'll see that yellow line start arching up, and that's ovulation, okay? So day 14 is the best day for a woman to get pregnant, typically. Now, granted, most women's cycles do last 28 days, but that's not everyone. Every woman is unique, every woman is different. So just in a roundabout way, in the perfect NCLEX world, that's kind of what we're talking about right now. Day 1 is when the period starts. A typical cycle will be 28 days, and day 14 is when a woman is going to be ovulating. Okay, so that's kind of what these show, these different hormones. And as you can see with ovulation, the lining of the uterus wall, which is that bottom, in the graph, it's the very bottom, here it is, right here. This is the menstruation flow, okay? So day 1, she's sloughing off, but day 5, she's starting to build back up. Day 14, like I said, that's when she's releasing an egg. And a woman's job is to become pregnant. Like, that is the whole purpose of her reproductive function. So by day 14, day 15, that wall is starting to build back up and get full of luscious tissues, just thick tissues ready to accept that egg and embed it into her uterine wall. And so that is what this picture is showing. It's showing that the line is building back up. Now the egg is released right here on day 14, 15. And if it has not been released, or if it has not been fertilized, then that's when these hormones start sloughing off, the wall starts sloughing off, and the cycle begins all over again. She starts to bleed, and then we build back up, and then if we don't have a fertilized egg, we fall back down. You'll also see progesterone and estrogen. They're really high when it's at that peak. Whenever it's after ovulation, we're waiting for the egg to be fertilized. If it does get fertilized, then those levels will stay up. The progesterone, the estrogen, they'll remain high. If, however, the egg does not get fertilized, those things drop off and we start over. So menstruation is the casting away of blood and tissue debris from the uterus as the inner lining sheds. Flow typically lasts about 4 to 6 days, and it can contribute to low iron stores and anemia. So NCLEX loves nutrition questions. So whenever you're thinking about a woman who is trying to get pregnant, a woman who has heavy periods, you're always going to be thinking she might need some iron, okay? So just always keep that in the back of your mind. Menstrual, it encompasses the events that transpire in a woman's reproductive organs. And it happens between 2 menstruation periods, okay? So you have your day 1, you have your day 28, back to day 1. Okay, so 2 main components are the ovarian cycle and the uterine cycle. So the ovarian cycle is, it includes the follicular stage, which is controlled by the FSH hormone, okay? So the follicular stage happens between days 1 through 14 of that typical 28-day cycle. And this is also where ovulation occurs. Remember, day 14, you're thinking ovulation. The ovarian cycle also has a second hormone, which is the luteal phase, and it's controlled by the luteinizing hormone. This is at the end of the cycle, days 15 through 28. The uterine cycle, which I should have bolded that to make it stand out to you more, this is actually referring to the changes that occur in the inner lining of the uterus. Okay, so you have 4 phases in this stage. In this cycle, we have our menstrual phase, which is day 1 of the menstrual cycle, the onset of menstruation. And this has 2 low levels of hormones. So what do you think those hormones are? Day 1 of menstruation cycle, onset of menstruation, what are going to be dropping down? Okay, we'll talk about it in class. Think about it, fill in those blanks. The uterine lining is shed, follicles begin to develop, and it ends with the menstruation period, stops on approximately day 5 of the cycle. Okay, next phase is the proliferative phase, and this is the uterine lining becoming thicker. It ends with day 14 of the ovulation. Secretory phase is the corpus luteum begins to produce what hormone? Think about that one. Get back to me. And starting to prepare for pregnancy. Okay, we talked about 2 hormones that really help with pregnancy. There is one in particular that is the best. It's the one that maintains the pregnancy. Okay, and then our last phase is the ischemic phase, and this happens on days 27 and 28. Estrogen, progesterone levels start to fall. The uterine lining becomes ischemic and it begins to slough off. Okay, so during all of these phases and changes that are taking place in the woman, she also has changes in her cervix and the cervical mucosis. Okay, so menstruation phase, the cervix does not produce any kind of mucus. It's during that bleeding phase, there isn't any kind of mucus taking place there. But the proliferative phase, all of a sudden she begins to form this tacky, kind of crumbly type of mucus that is yellow or white. And then in ovulation, think about this, ovulation, the woman's body is wanting to get pregnant. All of a sudden it becomes a stretchy like quality called a spindle bark. And there is actually a picture of that on, I think it's page 75. And what that is it's kind of sticky, and it will, if you do your fingers like this, it will actually stick from one finger to the other. And that can be a type of birth control for some people if they want to do that. Yes. Okay, so ovulation, the woman's wanting to get pregnant, and you have this mucus that is sticky-like. It's amazing to me, the body. Like, the female body can do so much. I mean, creating a human and growing a human in them. But even at the first stages of this, already in ovulation, you have a mucus that is sticky, so it can grab onto those sperm and it'll hold on to them. It wants to get pregnant. The body wants to get pregnant. Okay, so after ovulation, the mucus becomes skinny, thick, and opaque. Okay, and the acidity in it also changes. There's no purpose in getting pregnant now, so it just it almost repels sperm away from it. Okay, one term that you need to know with OB, and there's so many terms. If you can get the vocabulary in OB, you will be doing great. So study your vocabulary. But one thing that you're going to hear over and over again is, when was your last menstrual period? And they'll write it out LMP, and you'll see LMP on all the charts. And for a pregnant woman, you better just know, because everybody's asking you that. When was your last menstrual period? Okay, so if we know their last menstrual period, we can actually figure out when their due date is. And so this is kind of a cool trick that you'll learn, and you can go ahead and practice it now and start asking your friends, hey, you're pregnant? Well, of course, ask your pregnant friends, that might help. But ask them when their last menstrual period was, and you can guess their due date approximately within a few days by just knowing when their last menstrual period was. And what this is called Nigel's rule. And so what you do is from their last menstrual period, you add 7 days, like add an entire week plus 7 days, but then minus 3 months, and that is their estimated due date. So work on a couple of problems like that, try and figure it out, see if you can, and then we'll also work on that a little bit more in class. Okay. So menopause is when reproductive capability completely ends. The ovaries cease to function any longer. Hormone levels are raging. That's why the women are having hot flashes all the time, and they're just miserable. Their hormone levels are completely off. There are a couple of things that you can do for this, and you can add hormones. However, this has been a controversy, especially in more of the oncology world. We see where women will start taking ovaries, not ovaries, they'll start taking hormones, and because of that, sometimes it puts them at risk for breast cancer or something like that. So if you've ever had breast cancer, if you have anyone in your family who's ever had breast cancer, then they really recommend that you don't do hormone therapy. Instead, it's just kind of bear with it, and it sounds terrible, and we hate to say that, but at the same time, it's better to go through those terrible hormone changes than to have a risk of breast cancer too. But that's not for all women. Some women do take hormones and they do perfectly fine with it. Usually this hits between the ages of 47 and 55. Okay, and that is all.